Well, our Bronson Health Chat segment for this week, dealing with National Atrial Fibrillation Awareness Month. That is happening in this month of September. Dr. Christopher Rogers is an interventional cardiologist at Bronson Advanced Cardiac Healthcare, and we're going to discuss atrial fibrillation, or Afib as it's commonly known, on our Bronson Health Chat this morning. Dr. Rogers, good morning.
Good morning, Ken. How are you?
Doing well. Thank you so much for joining us. I suspect that most people's knowledge of Afib is just what they've probably seen in television commercials. So let's talk about what atrial fibrillation actually is.
Okay, atrial fibrillation is a very chaotic rhythm from the upper chambers of the heart. The heart rate's up in the upper chambers. Actually, the upper chambers are just quivering. That quivering action can drive very rapid heart rates in the lower chambers of the heart. And the biggest issue with atrial fibrillation is need for rate control, potentially trying to maintain normal rhythm, and then assessing what a patient's risk of stroke would be. Atrial fibrillation that is untreated, depending on the patient's other illnesses or other medical problems, does create an increased risk of stroke for those patients. And so making a determination of which patients should have heart rate control and anticoagulation or blood thinners as appropriate versus patients who should pursue a rhythm controlling strategy and blood thinners as appropriate based on their risk. That's kind of the crux of how we manage atrial fib.
What are the symptoms of Afib? How would you know if you had it?
Sometimes a lot of people who are symptomatic with it, they feel as though it's described as a bag of worms flipping around in their chest, but they are aware of very rapid heartbeats or a pounding heartbeat sensation in their chest. Some patients only notice that they have a dramatic decrease in their exercise tolerance. They can't do the things that they need to do. Other people are very, very symptomatic, having sometimes chest pain because of the very rapid heartbeats. Sometimes they have overt heart failure where their lungs get congested with fluid because their heart rates are so fast that their heart becomes inefficient in its pumping.
Doctor, how is Afib treated?
As we discussed, either rate control and blood thinners as appropriate versus rhythm control and blood thinners as appropriate to reduce risk of stroke, control heart rates so that patients don't develop a weakened heart from very rapid heartbeats that persist for a long time, or if they truly are very symptomatic and they feel their atrial fibrillation, trying to maintain normal rhythm with rhythm-controlling medications and sometimes procedures by my electrophysiology partners to try to maintain normal rhythm is prudent and appropriate based on patient symptoms. But the big thrust to reduce their risk of stroke is appropriate determination of who needs a blood thinner and who does not.
And so what is the difference between blood thinners and the other treatments? Is there one that you would choose over the other?
Well, right now, the current guidelines suggest that we treat people with blood thinners as appropriate. If people have certain risks or they have bleeding complications associated with their blood thinners, and there are certain risk factors that make people at high risk for taking blood thinners for the remainder of their life, and in those people who have high risk, there is a device called the Watchman device is currently FDA approved, and there are other devices that are coming out that were FDA approved to implant in someone's heart in the area where most blood clots come from that cause stroke, and that area is called the left atrial appendage. The Watchman device is a device that we can implant through the groin, through the vein in the groin, into the left atrial appendage, and over time the left atrial appendage gets sealed off like we walled off a room, and that reduces a patient's risk for stroke on par with taking a blood thinner. And then if the patient has a Watchman device in or another left atrial appendage occluder devices, that's what the general term is, if they have that in place and they take a baby aspirin, their risk of stroke is equivalent to them being on a blood thinner for the rest of their life.
Dr. Christopher Rogers from Bronson Advanced Cardiac Healthcare with us on our Bronson Health Chat on WKZO talking about Afib, atrial fibrillation. Is that an invasive procedure, a Watchman? Does Bronson have a lot of experience with this?
Yes, we've been doing Watchman implants since April of 2018. So we do have an extensive experience with implantation of the Watchman device. We've been around from the first generation of Watchman to the second generation, which has enhanced our ability to close more atrial appendages. It is an invasive procedure. The patients do get put under general anesthesia so that they do not experience what we're doing for them. They require a fancy ultrasound of their heart so that we can see what we're doing with our ultrasound colleagues or our echocardiographic colleagues. And it's a device that we implant from the vein in the groin, usually on the right side, up from the right side of the heart to the left side of the heart, implant the device, and then everything comes out once we are all satisfied that we have an excellent implantation.
If someone is living with AFib or knows someone who is, they may be wondering about Watchmen or other treatments, so what should they do to find out more?
If they are curious about Watchmen, so have a loved one who lives with it or they live with atrial fibrillation, I always refer them to their primary care doctor. If their primary care doctor is unfamiliar with it, Bronson does have a website, bronsonhealth.com/heart, where they could get more information about the Watchman device. And then if it is felt by their primary care doctor that they're appropriate potential candidates, then we are more than happy to see them here and finish the workup and implant if it's appropriate.
Dr. Christopher Rogers has been with us on our Bronson Health Chat this week, interventional cardiologist at Bronson Advanced Cardiac Healthcare, talking about atrial fibrillation or AFib during National Atrial Fibrillation Awareness Month. A very intense topic and a very important one. And Dr. Rogers, thanks so much for sharing it with us this morning.
Ken, thank you. I hope you have a great day.
And you as well. Kalamazoo Mornings with Ken Landfear on 590 and 106.9 FM WKZO.